Okay, this review is for PowerPoint 8B, the second of the two joints PowerPoints. All right, this diagram is pertinent, and I would spend some time understanding it. You have a view of the arm here, and in this one picture, you have really all the joints that we've discussed so far. The first joint mentioned here is the plane joint, the most limited in movement of the 6 types of synovial joints. This kind of movement is called non-axial. There is no change in angles here. It's just a slipping back and forth of bones over each other. The example of the plane joint here, the non-axial plane joint, is indicated in red. This is a carpal joint. And between your two little marbly wrist bones, all you get is this kind of back and forth slipping movement that occurs there. Next up is a hinge joint. A hinge joint, such as at your elbow, in between your fingers at your second and third knuckle. And in your knee, as well as another example. This is considered a uniaxial joint. There's movement in one plane only. And let's get to our picture. So the uniaxial hinge joint here is indicated in purplish, letter B. This is the joint between the humerus and the ulna. When you flex your forearm, that is a hinge movement. And when you extend or open up that same elbow joint, that is also part of movement at that hinge joint. It's not indicated here, but also in the second and third knuckles in the finger. This is also a hinge joint. So this is a interphalangeal joint, so a joint between two phalanges, so a phalange joint. Again, if you bend your fingers, you can only move that in one plane of space. The tip of the finger, right, only kind of beckons someone over, or inappropriate to say, right, if you're flipping someone the finger, right, I guess that's not a hinge movement. So a hinge joint, only the second and third knuckle bending or opening the finger. Pivot joint. Pivot joint is also a uniaxial joint, just like the hinge joint. The example we talked about in class was shaking your head no between the first cervical vertebra, called the atlas, and the second cervical vertebra, called the axis. Another place you find this is when you pronate or supinate your forearm. The joint between the radius and the ulna is also a pivot joint. Here in the diagram, letter C here. This is your radial ulnar joint. Again, that's turning your forearm over and back. Pronation, supination, that's a form of rotation that occurs at a pivot joint. And the other one mentioned was at the vertebra, which is not shown here. So we're moving up to a biaxial joint. So we have movements in two planes of space. So you get something like flexion and extension, plus your abduction, or I guess I started with adduction, abduction. So with the tip of your finger, you can only wag it back and forth. But if I talk about the first knuckle, which is this joint, you can wag your finger side to side, kind of like no, 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 or up and down. And then the other place you find this joint is in the wrist between the radius and the carpals. Again, with your wrist, you can wag it side to side as if waving to someone, or up and down. That's considered biaxial movement. So if we look at the green here, letter D, the first knuckle, right? That's the first knuckle. That's between the hand bone, which is called a metacarpal, and the finger bone, the phalange. So metacarpal phalangeal, that's a biaxial movement. That's called a condyloid joint. The other one would be between the radius and the carpals, right there. Radial carpal joint. Also a biaxial joint permits more movement. Again, you can see from the arrows here the movement in two different planes of space, up and down and side to side, so to speak. The other biaxial joint is the saddle joint. This is a unique joint found only in the thumb. The saddle joint is here, letter E. That's a carpal metacarpal. I don't know if I want to write all this. Carpal metacarpal joint. So buried here deep in the thumb. That's a biaxial joint. And then the most flexible of the joints, we call a multi-axial joint, is present in the shoulder and the hip, and these are the ball and socket joints. The shoulder is a little bit more flexible than is the hip, and there's a slide on that as well. And up here in your shoulder, between the humerus and the scapula, is your ball and socket joint. A little bit on the knee joint. A knee joint is considered a hinge joint. Its primary movements allowed are in one plane of space, being flexion and extension. We discuss the ligaments a little bit more here. So in this diagram, what's labeled as the FCL here, I prefer to call the LCL, the lateral collateral ligament. The fibula is the outside leg bone, therefore that would be the lateral collateral ligament. And then the MCL is going to be this one here, which is the tibial collateral ligament. Remember, the tibia is on the inside, or occupies the medial position in the lower leg. So these two ligaments are important in stabilizing the knee joint. If we think of a blow to the outside of the knee, such as might occur in football or another sport, what happens here is the LCL has all this tissue behind it, all this tissue in here. So it has, which acts as a cushion behind to the inside of the MCL over here. There's just space. So what happens is the MCL often gets stretched and often tears. So let's put a little asterisk here by the MCL. Similarly, these two ligaments, the ACL and the PCL, the ACL is the one that's more often damaged. The other structure mentioned here that's specific to the knee is the meniscus. Meniscus is a piece of cartilage. It has a shape of a meniscus or crescent moon, thus the other name semilunar cartilage. And like any cartilage at a joint, the function of the meniscus is to reduce friction. So in this diagram, you get a view of the ACL here and the PCL here. These ligaments are called cruciate ligaments, which implies a cross or crossover. So what these ligaments do is they literally cross over one another, and thus the name. The ACL starts out in the back of the tibia, inserts on the back of the femur, inserts on the front of the tibia, and the PCL starts out on the front of the femur and inserts on the back of the tibia. So they cross over, and thus the name cruciate ligaments, the ACL and our PCL. You also get a view of the meniscus here, which is these cartilage pads that kind of possess these crescent moon shape that sit on top of the tibia. Again, an act to reduce friction. This slide discusses what I mentioned a few minutes ago, the idea that the shoulder joint has a little bit of a greater freedom of movement than the hip joint, though they're both ball and socket joints. And the two principal reasons are because the socket in the shoulder is shallow, so the joint is not as stable as is the socket, as is the hip joint, because the socket in the hip joint is the acetabulum is rather deep. You could drink at things almost like a bowl. And the ligaments in the hip are a little thicker and tighter, whereas the ligaments here in the shoulder are looser. All right, good luck.